The most common mnemonic which we use to manage any sports injury is called PRICE. So what it stands for is, first one is P is for protection. So the protection means that once somebody sustained an injury while playing sports, then they should protect it from getting any worse. The second one is rest. So after any sports injury, it's important to rest that injured part for it to recover in time. The next is ice. So ice is useful, and again, that can help to reduce the swelling and help in the relief of the pain as well. Next thing which can be done is compression. So that's kind of just putting a bandage on the injured side. So that can reduce, again, the swelling and the pain. And then the elevation. So the elevation means that if it's an injured limb, for example, then it should be kept a bit high, so that reduces the swelling. So most injuries, especially sports injuries, can be managed with just a simple algorithm of making sure that things do not get any worse, and then they settle with time. In my opinion, the sports injury management is very important. The reason for that is that if it is not managed properly, let's say if somebody injured it and they try to carry on playing, or they're trying to be brave and carry on doing their day-to-day activities, and they haven't managed the injury properly, then it can result into a chronic problem. And unfortunately, once the injury doesn't recover and becomes a chronic problem, then it needs further intervention and a long recovery period. And occasionally the injuries do not recover fully. So again, I think, as I briefly mentioned already, that the consequences of not appropriately treating an injury is for making it a chronic problem rather than an acute problem, which will settle with time. And if it becomes a chronic problem, then there could be scarring of the muscles if the muscle is injured. If there is damage to the ligaments or meniscus, then again, they can get further damage if somebody continue to play sport and they're not looking after their injured part. So the whole idea is for any injury to manage it with what we said earlier, with a simple advice about protect, rise, elevation, compression, and then go to the rehabilitation phase and fully recover from that injury before it becomes a chronic issue, which is quite hard to manage in the long run. So the most common procedures, as most injuries can be managed simply with the first aid management. Sometimes they do need analgesia with a period of rehabilitation. However, occasionally, if the injury is not settling, then it needs further investigations, further treatment. Those investigations, after I speak to my patients, depending on what their problem is, based on the history and a thorough examination, sometimes I have to arrange investigations in the form of an X-ray, an ultrasound scan, or CT scan, depending on which part of the body is injured. And then that will determine what exactly the problem is before we can proceed for any treatment. And the treatment, again, starts from simple analgesia, rehabilitation, and then again, if we give you an example of the knee, then it depends what is injured, and then that will determine what needs to be done. So if it's a meniscal injury, then sometimes it can require repair or resection. If it's a cruciate ligament injury, then sometimes it can require reconstruction. And similarly, if they do not have any significant injury, but they're still in a lot of pain, then again, they can be provided with different types of injections. It could be local anesthetic or steroid injection. It could be hyaluronic acid, which is an artificial joint fluid or tendon injection. And also, specifically, sometimes they do need special blood products, for example, in the form of platelet-rich plasma. So again, it depends on what the nature of the injury is. Important diagnosis is important after talking to the patient and examining them, and then confirming the diagnosis with the investigations before starting the rehabilitation process.